How would you deal with the following situations? Your 2-year-old is having a temper tantrum because he wants this toy. Would you just leave him alone till he calms down? Would you give in to his demands and give him the toy? Would you put him on tranquilizers? Your 7-year-old is nervous about Little League tryouts coming out in a couple of weeks. Would you assure him that he will be okay, he'll be able to do it? Would you maybe go out and work with him a little bit, practice batting and pitching, and build up his confidence and skills? Would you put him on Valium for a few weeks until the tryout so he wouldn't be so nervous? Your 12-year-old daughter is kind of upset because nobody invited her to the first school dance. Would you see if you can get one of your friends who has a son to accompany her to the dance? Would you tell her just go anyway and have fun? Would you give her cocaine to pick up her spirits? Your 15-year-old is pretty upset because she's 5 pounds overweight. Would you try to start cooking lower calorie meals and try to get her to eat healthier foods? Would you try to get her into a sports or exercise program? Would you put her on appetite suppressants until she could lose her weight? The third choice in the above examples was, of course, ridiculous. You wouldn't do this to your kids. You wouldn't put them onto a drug to try to just help them deal with what is just normal growing pains. As children grow physically and mentally and socially, they have these awkward experiences and times, and they get sad and they get upset and they get depressed from these events going on. But time and experience will help them get through these time periods and to grow emotionally. Well, the fact is, adults also go through changes in their life. Even after they're fully grown, they still have emotional reactions to events going on, and emotional growth, and professional growth in their careers, and social changes that go on in their life. There's still time periods where they have the same feelings that kids will have, the same sadness or anxiety. The way many smokers have dealt with this throughout their whole life is by just administering one dose after another of nicotine through their cigarettes to deal with these exact same sort of feelings. You have to consider what they have turned to. Again, you may remember yourself saying, if you quit, you're going to gain a little bit of weight, or maybe you're going to think you're going to gain a lot of weight. You're going to be more nervous. You're going to be more upset. You're not going to be able to have fun. It's the same sort of stories you were hearing from the children example above. And again, you were using cigarettes to deal with it. You were relying on a product which had a 50-50 chance of killing you, which was crippling you, which was basically costing you a small fortune over your lifetime, that you weren't just going to use during these awkward moments, but you had to use day after day, year after year, decade after decade, and pay all the consequences that were going to go with it. And bottom line is, they weren't solving the problems that you were looking them to solve, especially when you were thinking about, you can't have fun without a cigarette, or you're going to be a more nervous person without a cigarette. These are totally false beliefs. I'll attach a few videos into the description here addressing why you have some of those false beliefs. But the bottom line is, don't turn to a drug that has such an addictive potential and such a lethal potential to basically continue to grow as an adult and to be able to grow in a way where that you'll be generally happier and healthier. It's a matter of stopping smoking, and when you're encountering these life moments, understanding that you'll get through them one way or the other. If you were to take a cigarette, yes, you would get through them, but you know what? If you don't take a cigarette, you'll get through them too. And you won't be relapsed back into a drug addiction. To be able to be free for the rest of your life, it's a matter of sticking to the personal commitment that you hopefully make the day you stop to never take another puff.